Hello friends, welcome to day 17 of our quarantine series. I'm Dr. Prachi from Shri Clinic and here we are discussing all health related topics. Today's topic is my personal favorite, which is infertility. Yes, but unlike every day, we will be doing this part in this particular topic in two parts, that is infertility female and infertility male. That is male and female infertility are two different entities, are two different things, absolutely. So to understand that, we need quite a time, and everything cannot just fit into just 10 minutes of a video. So let's start with today's topic, that is female infertility part 1. Yeah. So when we say about infertility, first of all, on basic grounds, we need to understand that infertility is related to both male and female. That we need to understand. And when we say this, we should be knowing the reproductive organs of both male and female respectively. So when we talk about female, we have uterus, we have fallopian tubes and ovaries in picture, where we want to consider the fertility grounds. And in males, when we talk about, it is the scrotum, it is the vas deferens, it is the testis and the penis itself. So all these organs all together, totally, they form the fertility grounds for the reproduction of your next generation. But the problem arises when there is problem in this particular things. In females, along with the organs, hormones are necessary. In males, along with the organs, semen is important. Of course, hormones on a basic grounds, they are equally important for both female and males, but more probably, more on a stressful level, more in the females. When we talk about female infertility, definitely we have to start with uterus, fallopian tubes, then the cervical area and the ovaries. In all these four organs, the most important organ which plays a major ground level importance is the ovaries, because ovaries are the ones who pick up the sperm, that particular sperm which it wants to ovulate and then form into the next womb or zygote or whatever. Right? So when we talk about this particular female reproductive system, so when ovaries, when the sperm is fertilized from the ovaries, it will pass through your fallopian tube and then to the uterine cavity, and then the baby is formed in the womb or in the uterine cavity. This is all known as the normal reproduction after the exact process of coiton. Now, what are the problems that is faced? One is irregular menses, second is PCOD, third is overweight, and fourth is mostly thyroid. Because of all these four things, they are just interrelated. Also, as in yesterday's topic we have discussed, stress is another important factor. In some couples during infertility, we see that all the reports are absolutely normal, but they are not able to conceive. This is where stress comes into matter. We need to see what type of stress you have, whether the stress is being vomited out or just thrown out. If it is not, yes, it is troubling you to a much level where the reproduction is being hindered. Now, infertility, as in the basic infertility, is of two types. One is primary and one is secondary. When we say primary infertility, it is for the first baby that the couple is trying. When you're married for 1 year, that is fine. Within 1 year, if you're not having baby, we will not call it infertility. But if you have been married for 1 year and then when you're proceeding for the trying for conception, definitely it is infertility when it is more than 1 year. In secondary infertility, it is that you already have a baby and you're trying for the second baby after 4 years of having the first baby. Then it is secondary infertility. This infertility basically is very grounded to all our basics. When I said all the reproductive organs, all the hormones and the main genital organs which we are dependent upon on daily basis, is definitely the first and foremost important reason we should be seeing for our infertility. Then of course to the next levels, that is what type of diseases you have, if you have any stress and all those things. But now in this era, definitely stress is the most important cause of infertility. That is what we have been seeing. So in today's session, we will be seeing what all diseases or what all problems in our health can cause infertility. One is PCOD. PCOD we are all very much aware of. That is, there are cysts formed in ovaries and which are not able to regulate hormones, and therefore you have irregular menses. When you have irregular menses, of course you are not able to conceive. Secondly, it is not that with PCOD you cannot conceive. Definitely you can conceive with PCOD and PCOS. It's not much a very big concern. It's definitely fine. We have treatment for that. Next comes thyroid. Yes, definitely thyroid, as we have discussed in our thyroid video. Thyroid is the basic the main head of our reproductive system. If it does not produce good hormones from your brains, you're not going to have good hormones in your uterus. And if it is not that, definitely we will have a problem in conceiving. That's the basic rule. So when thyroid there are problems, most probably hypothyroidism, definitely there is problem in conceiving. Another important disease that is most very commonly seen is diabetes. When in diabetes, if you are not able to conceive, it is either or. So during the delivery or during the pregnancy, if you have diabetes, then also it is a worry. And if it is vice versa, that is, first you are having diabetes and you're not able to conceive, definitely it is also a thing to worry. So you need to first see your sugar levels, and if it is not that, it's not happening like that, definitely we have to handle with the treatments. And last, stress, as we said, because stress is affecting our brains so much that yes, we are not able to be fertile, and we are not able to conceive. That's it. Also, what are the symptoms? Symptoms will depend on the type of disease you have as a cause, of course. So when this happens, definitely the symptoms will be related to that particular disease. If you have PCOD, there will be irregular menses, weight gain, hair fall, acne, all these things. If you have thyroid, definitely there will be again irregular menses and weight gain with the thyroid functioning very going haywire and abnormal, and all the other things. In diabetes, of course, you will have headache, the 3 P's which I have told you already. All those things you will have, and it will definitely depend upon the disease that you are having, the cause you are having. And yes, in stress, typically there are no symptoms as such, but it can hamper your emotional level and sentimental level, and then there will be frustration, depression, and all those things will come into the package. Yes, management is nothing but taking the treatment. Of course, diet and exercise is very important, but along with that, you need to burst out your stress, as we have discussed yesterday, the tips and tactics to burst our stresses. So if you can do that, nothing great than that. Of course, homeopathy, you have an answer to everything, and so homeopathy is definitely an answer to infertility. Yes, it can cure infertility if you give your homeopath the exact good history of yourself. If the perfect simillimum, what we call the perfect medicine upon related to your constitution, is perfectly taken out, it can definitely give you a good fertility. Homeopathy, what it does is, as you all know, goes to the root cause, goes to the origin of the problem and takes out that cause. One. Secondly, it regulates your hormones, and whatever disease or type of symptoms that you're having, it will first tackle with that. And ultimately, gradually, you will go to that particular goal or whatever you want to achieve. It may be infertility, it may be diabetes, it may be BP, it may be anything. It may be anything. Homeopathy is the answer. So why I stressed out homeopathy here today is because today is World Homeopathic Day, that is 10th of April, and today is our founders, that is Dr. Samuel Hahnemann's birthday. And I'm wishing you all a very happy World Homeopathic Day. May we get out of this corona on this wonderful day, of course, and please stay home, stay quarantined. We are still quarantined and we will fight this corona. So I wish all my fellow homeopaths also a very happy Hahnemannian Day. And that's it for today. Thank you for watching the video. See you in the part 2 of infertility tomorrow. Thank you.